I'm Dr. Ryan Shaw. I'm one of the hand and upper extremity surgeons here at OrthoKansas. So I chose to become a physician. I think in college I was kind of a science nerd and I loved doing all the experiments and learning all the anatomy. And I ended up choosing medicine because I just wanted to help people and kind of see more tangible improvements in their lives. So I would describe my philosophy of patient care as being individualized and patient-centered. I think a lot of times there's many different ways to treat a particular problem, and the goal of my job is to find the right treatment for the right patient. If I was to share some advice for patients, I think it's very important, especially these days, to make sure that as the patient, you really advocate for yourself and take a lot of ownership of your own care. I think it's a two-part relationship. Half the puzzle piece is the physician, the surgeon, and then the other half is the patient. And so the two of us, we work together and ultimately try to have the same goal of having you kind of recover and get better. Yeah, so something personal about myself. I grew up and I played tennis and I swam, and I had a decent amount of orthopedic injuries growing up. So to a certain degree, I kind of know what it's like to be a patient and kind of going through that sometimes frustrating road of recovery. So I would like my new patients to know that I'm a Kansas boy. I grew up here. I went to undergrad here at KU, and even though I did all my training here on the East Coast, I'm happy to be back home here, back with my family, and I'm looking forward to serving my community. So I think it's important for people to get care close to home. I think ultimately a lot of the recovery that we do is best done at home and close to people that you love, people that can take care of you. And I think especially when you get care farther away, it's harder to recover at the hospital, harder to recover without your support network there.